You know, we've had Dr. John Shufeldt on before on our show, and today he's featuring a top doc here in the Valley, a top doctor who's been on Phoenix Magazine several times, and he's talking to Dr. Nathan Laufer. Doctor, how you doing today?
I'm doing great. How are you doing?
Terrific. Thank you.
We're over here at Good Samaritan Hospital in the cath lab with, as you said, Dr. Nathan Laufer, who's head and founder of the Heart and Vascular Center of Arizona and one of Phoenix Magazine's top docs since its inception. About 6 years it's been, hasn't it?
About 6 years, yeah.
Wow, with everything that's going on in cardiology and all the changes that are going on, because I even hear about them, how do you keep abreast of all that?
Well, first of all, I read a lot and try and get to as many conferences as I can. And the most important thing is to continue to do research. By doing research and studying about new developments, it forces me to stay abreast.
Great. Now let's talk about that a little bit. What research or where do your interests lie right now?
Well, I'm an interventional cardiologist, which means that we try and keep people away from bypass surgery if we can. If we have narrowings in the coronary artery, such as we see over here, where we have very tight narrowing in a blood vessel going to the front of the heart, then today we can go ahead and put in little angioplasty balloons and metal struts or metal stents to try and keep the artery open.
Okay. Now, you probably sleep about the same amount of hours a day that I do. What's an average day like for you? Give me the start to finish.
Well, I usually start at about 7 o'clock in the morning, either with a patient or with a meeting. And on Tuesdays and Thursdays, I do these kinds of procedures most of the day. On Monday, Wednesdays, and Fridays, I might see about 25, 30 patients in the office. And my day tends to be broken up by emergencies and phone calls and whatnot. Never know what's going to happen during the course of the day.
On call weekends and nights typically?
On calls every third night and every third weekend.
Great. Now in our next segment we're going to be actually watching you do a procedure. Tell us about this patient and kind of what procedure you're doing.
Well, this is a 60-year-old male who had previously undergone a stent of his coronary artery about 6 years ago. He'd had symptoms of chest pressure from a narrowing in the blood vessel, and he was fine for about 5-6 years, and then recently he started developing the same kind of symptom. And the stent that we had put in about 6 years ago looks really good. It's up here. But what he's developed is a new narrowing in a different blood vessel in the front of his heart, and this is what we're going to attempt to fix today.
And that's actually one of the main arteries that feeds the whole front part of the heart. You said the left anterior descending artery?
That's right. This feeds about 40% of his heart muscle. It supplies the whole front and some of the tip of the heart, tracking all the way down to the tip of the heart over here. But there's really this one spot that's narrowed. If this were to close, there'd be significant damage to the heart muscle.
Now, can you tell us if there has been any damage thus far with some of the symptoms he's had?
He has not had any damage. His symptoms have only been with exertion. He hasn't had any rest symptoms, and we looked at his heart muscle, which looks completely normal.
Very good. So with this patient, you're going to be going in and putting a balloon in there to open that artery, and then?
We're going to be doing, putting a balloon in to make some space, and then we're going to be putting a stent in here to keep that artery open.
Very good. Well, Scott, next segment we'll be watching that procedure as it happens in the cath lab at Good Samaritan Hospital.
Man, that is absolutely fascinating. No question about it. I want to remind you of a website you can check out called aztopdoc.com. And Dr. Shufeldt and Dr. Laufer, thank you both very much, and we'll talk to you in the next hour. We're going to head back out to Dr. Shufeldt, who's talking to cardiac doctor Nathan Laufer. Hey, guys.
Hey, how you doing? Scott, we're not wearing leather and iron here, but we are wearing some lead and some paper. We're going to watch Dr. Laufer do a procedure here. Why don't you go ahead and kind of cue it up, Dr. Laufer?
Okay, what we have here, if you can look on the monitors, we have two little markers here, and that delineates a balloon that we have across this tight narrowing. What we're going to do for you now is we're going to be inflating the balloon to make some space for our stent. So let's just go ahead and inflate to 10 atmospheres. And you'll see a banana-shaped balloon which is stretching the blood vessel open. Okay, let's deflate.
And that's pushing the plaque against the walls of the artery.
That is pushing the plaque against the wall, sort of like a fist through a hot loaf of bread, making some space. And you can see that there's now more space. We'll just take a little film of that as we inject dye into the coronary artery, and we can see that already there's more space. Now we're going to take our balloon out, and we're going to put our stent in.
Now, when you say take it out and put it in, you've actually threaded it up over a wire through the femoral artery, which then goes right up to the heart.
That's correct. Okay. We have a catheter here, which is about 2 millimeters or so in diameter, that we put into the coronary artery. Through that catheter, we put a wire that crosses the narrowing, and over that wire we can advance balloons or little stents. And maybe we can just zoom in on this stent so we can see. Right here is a little metal stent which is deflated, and it is collapsed on a balloon. The balloon will then inflate, stretch open the metal, and then the metal will stay after the balloon is deflated and taken out of the body. So this is a fairly quick procedure, and patients really don't experience very much discomfort at all with this.
And so
Okay,
you've
got
actually
the wire?
dilated the blood vessel. Now as it's being held open, you put the stent in to keep it held open.
That's right.
Okay.
And what happens with the balloon angioplasty by itself is that 50% of these patients may come back with a re-narrowing. If we add a metal stent to this, as you can see being advanced here, then the re-narrowing rate is cut down to about 20% or so by 6 months. If we make it past 6 months, then we're home free.
Wow.
And we'll talk a little bit later this morning about some of the other techniques that we have should a stent re-narrow. Okay, let's hook up.
So you're saving him from eventual possible bypass surgery.
Dial back. Yes, we're saving him from bypass surgery. About 10 or 20 years ago, this patient would have to undergo general anesthesia and be put on the heart-lung machine in order to keep this blood vessel open. Go ahead and inflate.
And then a huge
Let's
cost
go to
difference.
10. Real huge cost difference. The cost of bypass surgery is about $25,000. Let's go to 15. And you can see that the balloon is now expanded, expanding the stent. And let's deflate. And now we're deflating the balloon, leaving the stent in place to allow more blood to come down this blood vessel. We'll just pull the balloon back, and we can see what this will look like here as I take a picture.
Wow, and that's a stent in the coronary artery.
That's a stent inside the coronary artery, and you can see the difference in your screen on your left compared to the screen on the right, which was the before. And
wow.
Just stop it there. Good.
Huge difference.
And that's a stent procedure. Takes about 10 or 15 minutes.
Excellent. So he went from what size narrowing would you say that was to the right there?
That was about a 90% narrowing on the screen on your right, and now he has no narrowing whatsoever here. And I think this is a very acceptable, satisfactory result for this patient, and I'm very pleased with the outcome.
And no more chest pain?
No more chest pain.
Very good. Well, Scott and Marty?
That's pretty impressive, I would say.
It's not leather and iron, but it's here in the cath lab.
Scrubs and iron vests.
Yeah.
There you go.
Okay.
To learn more about Dr. Laufer, you can check out aztopdoc.com, and he's the featured physician this month on it.
Yeah, I was going to say, because Dr. Laufer's been on the front cover of that magazine several times, hasn't he?
He is actually the poster child for Phoenix Top Doc.
Yeah.
So the doc, he's a cover model, basically.
There you have it.
Yeah.
Yeah.
All right. Thank you, guys. That
I'll
was,
see you in a bit.
that was
Yeah,
pretty
thank you.
impressive.
Yeah, Dr. Laufer's one of my favorite docs in town. He's
He
a good
knows
guy.
his stuff. Welcome back, everybody.
Yeah, we're talking about your heart health with one of the Valley's top docs, according to Phoenix Magazine. We're talking about Dr. Nathan Laufer, cardiologist here in the Valley, and also Dr. Shufeldt. Hi, guys.
Hello. How you doing, Scott and
We're
Marty?
great.
Excellent.
We are going to go kind of recap what just happened and kind of show you the inner workings of this. Why don't you go ahead and take it away there, Nathan?
Okay, we started with a very tight narrowing here in a blood vessel going to the front of the heart. This is about a 90% narrowing. We went ahead and stretched it open with a balloon to make space for a metal strut, which is a stent, and we'll show you that in 1 second. Next thing we want to do with this patient with blood thinners on board is we're going to put a little collagen plug in so that he'll be able to get out of bed a little bit earlier.
So I was saying, typically people have to lay, what, about 8 hours on their back?
They lay from 8 to 10 hours on their back. We usually wait for the blood thinners to wear off, then we pull the tube out, and then they have to lie flat for 6 hours after that.
Because I'll occasionally see them in the emergency department with a big hematoma or a big blood clot where they had the cath site done, and this prevents that.
This does prevent that, and what we're going to do now is you'll see a little bit of blood coming out of our tube. And that tells us that we're inside the lumen of the artery. We'll then take this out and put in our little collagen anchor, which has a little stitch next to it, and it's an all one-step procedure.
Wow.
Okay, go ahead and cut. Good.
All right, so how long does he have to lay on his back for now with this in?
With this in, he will lie flat for 1 to 2 hours. And this is an artery, it's not a vein, so normally it should be spurting, but with our little collagen plug, That's the end of the
Boy,
procedure.
that's amazing. Hey, why don't we look at that stent real quick to see what you put in on the inside of this gentleman's coronary artery.
Okay, this is a typical stent. It is a collapsed chicken wire strut that is mounted on a balloon. And what we do is we put this balloon and stent across the narrowing. We then inflate this balloon, which stretches open the stent. Once the stent is fully expanded, we deflate the balloon and we take the balloon out, leaving just the stent to act as a strut in the coronary artery.
Now, what's that stent cost?
This stent's about $1,000.
That is amazing. That's all the research and development behind it?
It's research and development, and the way to look at this is certainly an alternate for bypass surgery, which costs about $25,000. So I think this is a major advance in the field of coronary artery disease treatment.
Okay, real quickly now, signs and symptoms of a heart attack and who's at risk for them?
Well, I think there are several risk factors for heart attacks, certainly males over the age of 50. If there's a family history of heart attacks or coronary artery disease, that's an important risk factor. Smokers, all of you smokers need to stop immediately, if not sooner. Diabetes, high blood pressure, and high cholesterol. Now, 4 out of these 5 risk factors, all of them except for family history, can be controlled. And so we certainly can decrease the chance of having a heart attack or of having coronary artery disease or even needing one of these stents. Certainly the best treatment is prevention.
And one of the things you may want to mention, people with chest pain, don't wait around at home, wait to see if it goes away, get in.
Absolutely. People who have chest pressure, heaviness or tightness in the center of your chest, may go up to the jaw or down the arm. That can happen with exercise or even at rest. You really need to come to the emergency room to be evaluated. We don't mind if it turns out to be acid indigestion, but we'd hate to miss a heart attack.
Absolutely. Well, Scott and Marty, we'll send it back to you. We have one more segment, kind of looking where the future of this whole cardiology, interventional cardiology is. And to learn more about Dr. Laufer, they can check on aztopdoc.com.
Terrific.
Good.
Thank you guys very much.
Thank you.
Very enlightening.
Appreciate
Fun to watch.
that.